Welcome everybody to this episode of Doctor and Patient Conversations, brought to you by KAHO and Patient Safety Foundation. I am Nadira Chaturvedi, bringing you the voice of patients from Patients for Patient Safety Foundation. Today, we speak on a very important and a very broadly impacted topic of children's health. With its fast-changing world, we have many more challenges than came across 2 generations or 1 generation ago. Between career demands of parents, migration leading to smaller families and nuclear families without the support of grandparents and extended siblings, also the children facing extra screen times because of academic needs or recreational needs or even social needs, the disease spectrum and the children's health is undergoing a silent transformation. Add to that mental stress, performance pressures, peer validation, which all adds to more frequent sound of children also having depression, which was never there earlier. So today, to address all these and answer them, we have with us an expert pediatric doctor, whom we welcome, Dr. Gopika KS, who has 30 years experience and more in neonatal care, ICU care, preventive care, adolescent clinics, and of course, she's an NABH qualified assessor, quality person, and trainer. She will address the unspoken questions we have. Welcome, Dr. Gopika. Thank you so much for joining us. Over to you.
Thank you, ma'am. Thank you for the kind words. So as I started my career in pediatrics, the spectrum of diseases which we saw and which we were taught upon are completely different from what we are actually facing it now. That time it was more of, illness, diarrhea, infectious diseases, meningitis, and with little bit of, with more of malnutrition, undernutrition and malnutrition. Right now, because of various reasons, we are still seeing those cases, but other cases are actually come up more and more.
So, ma'am, what in your opinion are the new emerging syndromes and emerging challenges faced by parents as well as children in the modern day?
Yeah, the biggest emerging change is, as you said, the shift from the joint family to nuclear family, with the parents having less time, quality time. I would not say less time, less quality time to spend with the children. Children also having less quality time to spend with the parent. They are more interested to spend with their friends and, even just close their room and see their screens. That is one thing. Second thing, because of the lifestyle changes and the fast pace, obesity, and along with obesity, micronutrient deficiency in the land of plenty that we are seeing now. Then the mental stress. And then because of the climatic changes, increased allergies, both respiratory, skin, and even gut allergies, increase in cancer, increase in, early puberty, growth stunting. All this we are seeing nowadays. And even orthopedic
problems. With such a large variety and spectrum, let's see how we can handle one by one at least the 3 or 4 key elements, which we cannot turn the clock back. We have to go forward. We have to accept technology. We have to accept the digital world against the physical world, but maybe there's a way in between. Let's pick up the first and the most common complaint of screen time. What, ma'am, what doctor, in your opinion, are the outcomes, the fallouts of excessive screen time?
See, now the world has become, especially thanks to COVID, no one can go without screen. But we can have a healthy discussion among ourselves and among our child to know and set limits of what should be the screen time. You will be so surprised. The recommendation is till 18 months, no screen. Whereas we see even newborns shown the screen. So till 18 months, ideally it should be screen time only for, looking at the grandparents or just family time screen time. And after 2 years also, it should be only 1 hour, and that too, it's not 1 hour continuous. It should be at 20 minutes interval. With a break. 20 minutes at one stretch. And then even when you go to school age group also, they say 1 to 2 hours during working days or school days, and max is 3 hours during the weekends. And for teenagers, we really have to sit with them and have a talk on, what can be, what is an acceptable level. But more important, we should have how we can face this by having inside the house only, there should be places which are off screens. For example, dining table, or when you are having a family time, or when somebody guest comes. That should actually apply for the adults also.
For the whole family.
Whole family. You looking at Netflix and telling your child don't look at your mobile will not work.
That is not going to happen.
Yeah. And
Absolutely.
also we can have, all the family members can decide to have, okay, on Sunday from this time to this time, none of us will look at the screens.
Right.
We will be completely off social media. And for little more, bigger children who may be addicted to Instagram and other stuff, we can maybe tell, okay, 1 week, just let us switch off your Instagram or Facebook or whatever. Nowadays, Facebook is out of fashion, all
Right.
those other
Right.
stuff.
Right.
So that time, maybe adults can switch off their Facebook and WhatsApp also. So these are few things, because telling them no is never going to work.
It's not going to work. That.
Screen
And
is
does it happen?
supporting.
Absolutely. So detox and limited time bands for each
Yes.
age group. That's a lovely idea.
Each
And
age
all
group,
family doing it
along
together.
with the family.
You can't have only the children. Absolutely. Then,
And
ma'am, does it
also-
also have an impact on the cognitive development or the neurological development or physical development?
Excess screen time definitely has a impact on the cognitive development. It actually can reduce your ability to concentrate. Then it can create social barriers. You become more withdrawn. You're only inside your world.
Right.
And cyberbullying, we actually don't actually come and tell to the parent or to the teacher or to the doctor that they're getting cyberbullied. They just become more and more sad,
Right.
and they become more and more withdrawn. And when that happens, usually for us, we think of physical, somebody has harmed the child physically. But nowadays, more
Right.
than physical, it is the mental harm because of the cyberbullying, which is very, very, emerging problem, and which is very difficult to find out. And the children usually don't come out of it also, because they say that, okay, if I tell about my classmate or a friend or the neighbor child, you will go and tell that, and then again I'll be bullied by the peers.
The vicious cycle.
A
Yes.
vicious cycle. Okay. So, and of course, sitting and watching, you see, you don't simply, even I don't simply sit and watch TV or my Netflix or something will be there.
Yes.
Peanut.
You're munching.
So, yes, munching. So, definitely obesity. And then sitting is the new,
Posture.
bad thing to happen. So, again, posture problems, back pains, diabetes, hypertension, all these things. And now another thing is, all of them actually, they don't want they don't want to hear the parent. So, they have noise cancelling earbuds.
Noise buds.
It will be
Yes.
blaring, and the parent doesn't even know that it is blaring inside the child's ear. So
True,
again, hearing problems.
The auditory. I've seen better and better earphones. I just call them boxes, getting bigger and bigger and soundproof. You're right. But that would hurt their eardrums later, wouldn't it?
Yes, it
The
will
auditory.
definitely. Yeah, auditory. And it won't be that they'll be deaf. They will not be able to hear certain tones.
Fine tones. Yes.
So fine tones. So what happens in the class? The child may be able to write down maybe 75% of the notes, or maybe able to understand 75%, but the full impact they don't get.
That's a real loss. That's a real loss.
That's a real loss. See, if a person is actually deaf, then anybody will understand, okay, this person is not able to hear. Even the person will say, I'm not able to hear. But I'm actually able to hear, but I'm not hearing the whole tone.
Right. So there is a neurological damage as well. And when you spoke about munching, that brings me, I find it very contradiction. I mean, on one side, we are getting more affluent and more, people can afford and people spend more. In fact, if you say the whole budget on the kitchen food is much less than the overall budget. But still there is obesity, and yet it has malnutrition. You mentioned malnutrition, not undernutrition, but malnutrition. And then you hear vitamin D12 and vitamin B12, D and B12s are less. So how does this match up? Why does this happen? What is the correlation?
Yeah. Now, actually, what is happening is malnutrition in the land of plenty.
Okay.
Previously, it was real malnutrition, famine. There was no food. War comes, no food. Flood comes, no food. And in a particular area, for example, I can just tell, maybe in Kerala, during rainy season, there were only few type of food. Like, for example, some of those, underground food, and maybe mango and maybe jackfruit. You don't get apples in summer.
Yes.
Yeah.
Non-seasonal. Yes. Non-seasonal foods. Okay.
Non-seasonal stuff. So, but nowadays everything is available all the time. And of course, when apple is available, apparently fresh looking apple is available in summer, We should understand that it has been preserved. I mean, so many things have been put on it so that it looks so nice and red and juicy.
Absolutely,
So
absolutely.
my advice to parents is, okay, you may have money, you may have facility, but still try to eat food which is seasonally available.
Because the
Just
nutrition is
because,
different.
yeah, see, now in it is supposed to be rainy season and summer in Bangalore, but you see very nice cauliflower, very attractive cauliflower.
Right.
So which we
That is
never
a
used to
winter
see.
vegetable. That's a winter vegetable.
Yeah,
Yes,
which I never used to see it maybe 10 years back. Cauliflower, we had to wait for the winter to come.
that's true. That's
So
true.
that is one thing. Other thing is the food is there, but then what is the quality of the food? Quantity is there, but nowadays, high calorie, high sugar, with lot of preservatives and high fat and high salt.
Everything is gone into the
Salt
excess
is a
now.
big. See, people talk about sugar. Many people say we don't eat white sugar, we don't eat jaggery, nothing. But what about the salt?
Okay.
So my this thing is, see, there's no need, really, no, unless your health indicates something. There's no need to completely avoid salt or the sugar,
Okay.
because we have taste buds. No, we need little tasty food, but add pinches of this, not tons of it.
Okay.
And if you want chips, see, I tell the child, don't eat chips. Child is going to eat chips. The other alternative, make chips in the house, so that your oil is fresh and even the salt content is less. Next best alternative is the hot chips wala chips,
Okay.
not the Pringle, not the
Right. Not the
packet
packaged
chips.
one. Not the
Yeah,
packaged one.
because they have more salt and other additives. So, and vitamin deficiency, again the same thing, because people don't eat what we call as the rainbow diet. If you eat the rainbow diet, almost all vitamins will come. That means you should actually eat the food looking at the color, not at the not at the what is available. So you should have something which is green, something which is red, something which is white, something which is yellow in your plate every meal. That will sort of take care of almost all nutrition. Other thing, vitamin D, as it is, Indians are prone to get vitamin D deficiency because of, even though we have a lot of sun, because our skin, there is some biochemical things which prevent us from absorbing vitamin D as much as we expect it to. But still, nowadays, outside playing in the sun is very less, right? Children are taken in vehicle,
That's
brought
right.
back in vehicle, and we ourselves are so scared of what will happen. We can't send them out unless we are also accompanying them. So they are either made to play inside the house or in the basement where there is hardly any sun. So these are few things which, that is why nowadays there is a lot of malnutrition. Even though the child may not be even obese, child may be normal weight, normal height, but still they will have micronutrient deficiency.
Right.
Again, that will lead on to more infections. It's just like a vicious cycle.
True. So when you talk about more infections, is it because of the immunity going down, or is it because of exposure to environmental toxins, the plastics, the chemicals, the
Both.
fertilizers? What plays? How does the environment, the polluted air? We're always talking, especially in North India and urban cities, whether it's Bangalore or Hyderabad, polluted air, polluted air. How do you cope with that? You live in urban spaces.
Yeah. So one thing is, they, at a larger level, the government and all have to do something, but
Yes.
that is, I mean,
Coping
that's out of
mechanisms.
the scope
Yeah.
of this conversation.
Yeah.
See, at our level, what we can do, we can try to reduce our carbon footprint at our level.
Right.
Switch off the light, switch off the fan, fix leaky tabs. No need to use geyser when the water temperature is almost
Right.
comfortable.
Right.
No
Right.
need to. Nowadays, even schools are, school buses are AC fitted. Schools are also AC fitted. Even in, a city like Bangalore, where 6 months it is quite cold, so quite
Absolutely.
comfortable.
Yes. Huh. Yeah. Yeah.
So try to avoid all this. And in the house, try to, fix LED lights, or even, the
Yeah. Right.
no, the rated fridge
Okay.
and
Okay.
AC and all
Yes.
that
Yes.
stuff, so that your carbon footprint comes down. And again, try to reduce processed food, consumption of processed food, packet food. Try to cook in the
I
house.
was coming to that because our children, I've seen, because of the gig economy, because it's easy to order in and 10-minute Blinkits and Zeptos and Zomatos, they have changed our habits. I'm not saying spoiled our habits, they've changed our habits, and more outside food comes in. How does that impact a child's health?
See, outside food, definitely outside food, even if it's supposed to be home cooked food by your grandma, is not what is cooked by your own mother with her hand, with the less whatever spices
Right,
and all
right.
that stuff. Second thing is the package. So many packing. No, one Swiggy, your dry waste is completely filled up. The next day, your dry waste is
Again,
one big garbage bag. So that itself has, and where does these dry waste goes? It just goes into our rivers and streams, and I don't know
we are
where all
feeding
it goes.
ourselves the toxins. It's a
Yeah,
cycle. Yeah, right.
yeah. So we
So
are
does it
feeding
damage
ourselves out.
anything? Like I heard, I mean, a neighbor's child, pre-diabetic. How does a 10-year-old become a pre-diabetic? It was a bit shocking to me, you know.
Very common nowadays, pre-diabetic and even liver enzymes becoming
Fatty
little
liver. There's
abnormal.
something called fatty liver, which I didn't know
Yes,
what it was about, you know. Huh?
non-alcoholic
Right,
fatty liver. If we don't actually look at it at the childhood level, it can cause cirrhosis by around 30, 40, 50 years. Person will say, I never touched alcohol
right.
in my life.
Absolutely, huh?
Okay, so these things are very easy to control. See, the basic thing is move, 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 have lot of fiber, and try to eat home cooked meal as much as possible.
So which means we have to become mothers again,
No, as
grandmothers
much
again,
as
as
possible
much as
only I'm
possible.
saying, because all of us are very busy professionals. So once in a while, even in my house, I Swiggy it or Zomato it or whatever. But as much as
As
possible,
much as possible.
because
Absolutely.
I've seen children who are sent for that snack time, 10 o'clock snack time, chocolate cakes and
Yes,
stuff
night.
like that. Okay.
Dangerous snacking at that time.
Yeah, agree. Mother is working, father is working, but some breakfast is cooked in the house. No, the same idli or the same chapati can be made in a mini form and sent,
Absolutely,
or
absolutely.
some cut fruits, or a handful of nuts, handful of dry fruits.
So the
Maybe
choice is
depending.
important. You have a
Huh,
snack, but the choice of the snack is in, which is that is in
huh,
our control. The
yes.
quantity
And
and the
the
snack.
dry fruit and nuts can be even dipped in melted chocolate, so it becomes a healthy junk food.
Healthy junk food. That's a lovely term. Healthy junk food. I mean, I'm
Healthy
sure the
junk
children
food.
would go for the junk food one because
Yeah.
it also comes from exposure to the internet after the 90s when the world opened up and the internet opened up. The social media is now, of course, just less than 10 years, but people are exposed. And again, that's a contradiction. The family is shrinking, and yet the digital society is increasing, but nobody's happy. That you're caught between the two. How does that impact a person's self-image or mental health or whatever, and how does that impact the body, the physiology of the person?
See, you are always looking to be better than John's, better than your neighbor. So that itself will cause a stress in your body.
Yeah, yeah,
You may be comfortably placed, but still you want to have what the next
better.
person is having. Better, better, better. It is always better, better.
It's never
So
good enough.
yeah, it's never good enough. And also coming to see, we are exposed to, as you said, 10 years back, I didn't even know what is pizza or what is taco
Yes,
something.
yeah,
Yeah,
yeah.
but actually, if you go to Italy, you see that their pizza is loaded with veggies.
Which we
It
don't, we've
is
forgotten.
their pasta is loaded with veggies. Actually, they take only this much of pasta.
That's that.
The remaining is full of their veggies and meats and meat and other
Right,
stuff.
right, right.
Whereas we actually take this much of, even I used to cook like that, this much of pasta and then little bit of
Hardly
sprinkling of
little bit.
veggies. Yeah, saying that it is healthy because there is some vegetable over there. So that is one thing. And also there is a theory that geographically, if you are sitting somewhere, your body is actually tuned to digesting the food which is available in that place.
Okay, that's
There
right.
was actually an interesting study in which Japanese people have gone to US long time back, even before
True,
second
true. Yeah, right.
world war.
Huh, huh.
So Japanese are actually one of the people who have the lowest risk of cardiovascular disease, like myocardial
Right.
infarction and stuff
Yeah,
like that. So they've done a study. There were two cohorts of Japanese people who were settled in
true.
US. One cohort had actually changed their dietary habit to the Western habit. I'm not saying Western
Right.
habit is bad, whatever, the
Yeah,
normal
but
Western
it was
habit,
not
whatever.
genetically
Huh.
suitable.
The
Huh?
other people stuck to their original, more of fish and
Okay.
rice and all that stuff. And surprisingly, the risk of cardiovascular disease was equivalent to the risk of white population for the first cohort.
Right.
Whereas the second cohort, you still continued the original, walking and
Healthy
eating.
one. The healthy
I
habits.
don't say it healthy for Japan.
For healthy for Japan, yes. Huh.
Yeah. They had the same risk as the Japanese population, the
True, true,
people who are sitting in Japan.
true. Right.
So that is why, the problem nowadays, the fad is intermittent fasting, no?
Yes.
So
Yes.
actually, our ancestors were doing intermittent fasting because most of them were farmers. 6 o'clock is the breakfast.
Yes.
And before the sundown, the dinner is over because there was no electricity, so you have to eat your food by
True.
5:36.
That's true. That's
So
true.
that is what is intermittent fasting, no? 12 hours of eating and 12 hours of giving rest to the body. Here nowadays, I've seen even very close children who are very close to me. I've seen they will say, "Auntie, I'm doing intermittent fasting." Okay, what did you eat? My food breakfast starts at 10, and I make sure that my mother gives my food by 4:36. Okay, in the meantime, what did you eat? Oh, when I came, mother was busy, so I had that whatever burger and peanut chutney and peanut butter or whatever in the house. So that is not intermittent fasting in a healthy way. Yeah.
I noticed this when they want to have a late night, and then their breakfast is at 4 p.m. because they got up late, and they call it intermittent fasting. It's actually a
Yes.
bad sleep habit. So that's a bad sleep standards. Does that affect the body?
Yes.
I mean,
Chronic
irregular sleep timings. I
chronic
notice more and
sleep
more in holidays.
deprivation, chronic sleep deprivation actually creates havoc in our body. It can cause physical illness, it can cause mental illness, it can cause lifestyle diseases like diabetes, hypertension,
Oh, from
obesity
sleep, is it? Okay.
from sleep. Because sleep is very, very important for our body to reboot. We actually reboot our computer, even our mobile,
Yes,
everything,
yes,
but
yes.
we don't reboot our poor body which is working all the time. So nowadays, I see sleep deprivation even in children who are maybe in upper primary and lower
Oh,
middle
okay, young.
middle young. They don't want to sleep. There will be several reasons because one parent will
Parents are
wake up
awake.
late. They want to look at the mobile. They want to look at the TV and all that. So this can actually cause mood disturbances like irritability, anxiety, depression, difficulty in concentrating, difficulty in paying attention, behavioral problems like hyperactivity, impulsivity. Then they may be drowsy and they may fall easily. And
Ah,
long term effects are definitely academic problems, emotional behavioral problems, diabetes, hypertension, and yeah, overall one unhealthy person.
do you have a recommended sleep time for
Yeah.
age-wise, or
Recommended sleep time is there. So basically, any school age child should have a sleep of 9 to 12 hours.
12
10
hours?
teenagers should have 8 to 10 hours. Hardly they get 4 to 5 hours. Okay, I'll come to that. Preschoolers should have 10 to 13 hours. And anyway, infants and toddlers, as of now in India, I think we make them to
It's still
sleep.
not, they're still not contaminated by us.
Yes, we still make them to sleep.
Right,
So,
right.
see, nowadays the thing is the stress of academics. When I was there, I think maybe in medical school I had even 11th and 12th. I was a happy child. Maybe medical school or not even in medical school. PG time there was
Right,
some
right,
amount of
right.
stress. But nowadays, if you see, the stress is starting from the seventh standard because seventh standard they are pushed into some sort of a coaching center so that by 11th and 12th they are ready. So when I asked what, no, they are going for JE preparation. What is JE
Yes,
preparation at the age of seventh standard? So this is not preparation. This is just a way to make an happy individual into an
unhappy. Yeah,
anxious,
stressful.
no, anxious, fearful, who will later may pretend to do what they're supposed to do, but they behind the parents' back they'll be doing whatever they
They
want to
will
do.
rebel. Ultimately, they will rebel.
Ultimately they will rebel.
That's
So this is one thing which I find it very difficult. And children should sleep because see our body is made in such a way that when you're sleeping also your mind actually thinks about what you learned or what you saw and all that
right.
stuff. So there are few tips for sleep hygiene. Okay, this is very important. Sleep hygiene is very important, which I think even we have to learn. So, ideally, 2 hours before your sleep time, your last meal should be over, so that digestion, that metabolic heat and all settles down.
Settle down.
Yeah, and then 1 hour before, 1 or 1.5 hours before the sleep, it should be a calm entertainment, not video games,
Right.
not shouting at each other and all that. Maybe a quiet family time with some soft music, storytelling, or just recollecting what has happened that day. Many times I've seen that,
Bonding time. Yes.
yeah, parent will be asking what happened. Did you go? Did this class happen? Did that thing happen? Parents never actually share what has happened in their life.
Yeah. Yes.
So if you actually share, today was a very good day, everything went well for me. Otherwise, you say, okay, today was a little bad day because the boss was sitting on me. Then the child also understand that, okay, there can be days in which it is good and there can be days in which is bad, but the next day is not going to become bad.
Yeah. So it's okay. It's
Yeah,
okay to
it's
be.
okay. It's okay. One some days it will be bad, but that's okay. So that sleep hygiene and most important is bedroom should be used only as bedroom, not as a TV room,
Correct.
not as an eating room.
It
So
is sanitized for everything other than sleep.
yeah, and makeup and other thing is you can actually train the children to make the bed in the morning. That is a very powerful tool to calm the child to make them look forward to the next day completely
Right.
for the
Okay.
next
That's a
day.
nice idea. Lovely idea. Yes.
Because nowadays many children don't make the bed, no, they
No,
just
they
go
just
away.
leave it and go. They just leave it and go. Yes. I know. I know.
So making the bed, you can, of course, you can help the child to make the bed, and as they become bigger, I mean, age advances, they have to do the whole thing. Otherwise, at least the pillow, smaller children can be made to fluff the pillow and keep it.
Absolutely.
The bed
That was,
sheet and the bed
you
cover,
give
you can.
some wonderful ideas, ma'am. So, as a call to action, are there any new vaccines? There is so much about genetics. There is so much about self-medication. There's so much overload of information. Any maybe 3 tips for parents how they can protect, keep on with their careers, but prevent or at least mitigate harm by a future. You've given a lot, but I just concluding remark of anything.
Yeah.
You've talked
One
about
can
timing.
conclusion to the parent. I don't think that there are any bad parents as such. Okay,
Every mother's great, every father's great. They do their
every
best.
father,
I
every
agree with you.
parent
Yeah, yeah.
lives for their children only. Okay, maybe few exception will be there, but otherwise we don't intentionally try to do something bad for your child.
True.
So one thing is, the annual health checkups are very important.
Right,
See, generally what we see in pediatric OPD is till 5 years or maximum 7 years. I mean, most of the kids who are waiting will be 5 to 7 years.
right.
After that, we don't see them only. We see them at around 10 years for their vaccine.
For the
And
booster.
then if you are lucky, we see them at 15 years when they come for vaccine.
Right.
But one good thing which the COVID did, I mean, I can't say it as good thing.
Yeah.
Even the bigger children are getting more and more, respiratory infection. So they tend to come in more often
Okay.
post
For
COVID.
preventive health checkup.
Yeah, preventive health checkup is needed. It's not for for the hospital or the doctor to make money. Actually, during the preventive annual preventive health checkup, we actually assess the hearing, eyes, and how the child is coping in the school, whether there is any scholastic
It's
difficulties.
it's a holistic checkup. Okay.
Yeah, whether it may not be a proper IQ or a proper learning disability check, but by few screening tests, we can actually understand whether this child requires more elaborate testing. Many of these scholastic difficulties, if you catch early,
Yeah. So you can intervene earlier then.
intervene earlier, and they pick up very fast.
Right.
Usually, scholastic difficulties, I have had parents coming 2 weeks later is the board exam. They come to me and say, "My this problem is there. In 2 weeks, how can I solve it?"
True. That's true.
At
Yeah.
least during the study holidays, if they had come, something we could have done. So anyways, that is one thing. Second thing is, during annual health checkup, we actually assess their emotional, for example, if it is a middle school or a pre primary school child or pre primary school child, we actually assess whether they are ready to go to the primary. So if we feel that they are not ready to go to the first standard, we even advise them, okay, keep them in UKG one more year, so that the child is mentally ready.
So it's development related, not just calendar related.
Yes. So growth we assess, development we assess, and also we assess the and mental health issues. Nowadays we are seeing mental health issues even children who are 10 years also. Even children who are 8 years old also are anxious. They are fearful. So annual health checkup is needed. In newborn period till 1 year it should be monthly once. After that it can be anywhere till 5 years, almost every now and then they'll come in for vaccine, so that will happen. The annual health checkup will happen along with
Right.
that. Dental health checkup once, and then after that every 1 year, so that even the refractory errors we can pick up, even the
Early enough.
psychological problems, and even the obesity, malnutrition related things we can pick up. Yeah.
That's wonderful. Thank you, ma'am. Thank you so much for a wonderful
Yeah.
advice. As we went along, you told us about coping mechanisms, since we cannot change technology or the world, at least how to live a balanced salt versus sugar, or whether it was sleep timings, or it was screen timings, or it was just balanced diets. And I love the rainbow habit, and I love the the junk. What was the word you use? Healthy junk. I like that because they're not going to live without that. So that's a great topic, and I think
just
all our listeners.
one more word I want to say. This is actually to the parents. See, when your child is going through a troubled time, either physically or mentally, whatever, I have seen, parents actually feel a lot of guilt. They think that, this is happening only to my child. Is it because I was concentrating more on my career, or is it because there were other family problems? I didn't give enough. See, one thing I will tell, parents, please have your own parent circle, so that then you will realize that this is not a problem you are facing yourself by yourself. This is something which most of the parents are facing. So when you have a parent, it can be your colleagues or it can be friends. Best thing is parents of your children's friends.
The parent support group for each other.
Yes. So then you realize that, okay, everyone is facing the same problem. Then you might get some tips from the other person, how they solved it. You may be able to give some tip. Otherwise, it is like a one man, fighting against all this, no screen time.
And that victimized feeling is very bad. I mean, you
Yes,
go into a hole with that. Yeah, that's a great idea. Maybe we'll start one circle with you, ma'am, as the leader for all our young parents. You have so many wonderful ideas and practical ones because you've actually been practicing. So thank you for all those wonderful tips. And I'm sure our listeners would love it and watch it. Thank you for doing this.
Thank you, ma'am.
Thank you. Thank you.
Bye.
These doctor-patient conversations are brought to you by CAHO and Patients for Patient Safety Foundation. CAHO is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by CAHO, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.